We're back, dear viewers, with our guest this evening, Dr. Huda Almahdi, a consultant physician and a mother of an autistic child and influencer regarding autism in social media. Dr. Huda, good evening to you. It's really a pleasure to have you tonight with us on Hala Kuwait.
Thank you. Good evening to you too.
It's always a pleasure, Doctor. So how did you first realize your son was on the autism spectrum? That's really a great taking care of your son. It's a great effort from your behalf, and checking the condition of your son and also the medical condition of your son. You're such a brave mother, Doctor.
Well, thank you. I'm just a mom with the responsibility, that's all. Actually, I realized that Faris is autistic. Actually, he's my second son. So first of all, like, I'm a mom with an experience, like I have an 18 months old older than him. And then I was blessed to be a family physician, where part of my job is checking and following the milestones of infants while they're growing up to childhood. So I can follow the milestones, and I can detect any abnormal any abnormalities or developmental delays. I've noticed that Faris had such delays in his milestones actually at the age of 4 months onwards. But of course, at the beginning, I was in denial. I grew up in a family of 9. We're all very healthy. We're all university graduates. So I thought this is life, that I should be having normal children and design a nice future for all of them. But I didn't know that I am going to encounter a very difficult situation with my second son, Faris.
And you're such a brave mother. We are really saluting you for this effort in taking care of your lovely son, Faris. So what was the hardest part? Like you said, you were in the level of denial, but you took, or you're still taking great care of Faris. He's such a hero, and you're such a brave mother. But tell us about the hardest and challenging part after the diagnosis.
Of course, maybe you know that after breaking the bad news, parents go through some, we say, stages. It's a shock at the beginning, denial, and then anger, and then depression, and the later stage is acceptance. For me, that was the hardest stage, is accepting his condition. I went through all those stages, and it took me some time. Of course, denial took me about 2 years since I noticed his delayed milestones, until he was 2, when he was rejected from the nursery. Everybody was noticing that he is abnormal. But at that time, I was in denial, and then I was taking him from one nursery to another until I had to face it. Then I got the anger issues, and I felt so, I can tell you, guilty, because I thought I did not take care of myself while I was pregnant. Of course, that was the opposite. But you know, when you are facing such a dilemma, then everything goes on to your mind. And maybe I have accepted his condition later on when I started working with him. And then when there are so many factors, of course, that helps you out to accept his condition. One of them is being feeling that you're not alone, and there are people around you that might help you, and there are people around you are also suffering. So there is no need to be anxious about it. Then, you know, once he started to grow up, once I knew, I went to read, and with the resources, with the help of my husband, he was a huge support for me. I was able to help him out, and then to accept his condition and help others then accepting their own children.
Well said from your behalf. And now I felt like we were talking specifically and exactly and perfectly to Huda, the mother. Now, Dr. Huda, we want to ask you a question regarding you as a doctor. So you as a doctor, how did you experience this change in your life as a doctor? Tell us about, let's say, as a doctor point of view.
I understand. I remember this incident. I was having an examination during my Irish board, and my mentor, she was the one who was examining me. And then she was examining me how to examine a child and to check his milestones. She told me after the exam, I've noticed that you've changed. Because when I was enrolled in the board, I wasn't married. I didn't have any children. But later on, and she saw me, and she was my mentor since then. And then after that, she
thought you changed, like, not positively, negative.
In a positive way.
A positive way,
She told me, yes, and I saw how you are handling the child with care.
That's great, mashallah.
How you really changed. You've really changed. So this is how it changed me as a doctor, because later on, I understood any mother who comes to me so anxious, having a child with any disability, I would really empathize with her differently, even more.
Okay, so doctor, please, can you explain to us the reaction and also the help and support and receiving of the news from the family members around you, your own family, and also the big family around you, like your own house and also the rest of the family members?
Yeah, when Faris was diagnosed, at the time, autism wasn't very well known. Me, myself, I was really puzzled. I did not have any resources and I didn't know what to do. So the same thing happens with my family. I did not really inform them in the beginning because I didn't even know what was going on. But later on, you know, maybe you know that autism, part of it, the symptoms are they have some behavioral issues, like jumping around, not being afraid from strangers, no eye contacts. They have sensory issues. And remember, during Zwara, which is the family gathering, everybody noticed that Faris' behavior was totally different than the others. Then I started explaining to them and telling them about him. So they were so helpful. They were, because I stopped going to Zwara because I feared that something is going to happen to Faris because he wouldn't sit still. So everybody was embracing him. Everybody was telling me, oh, you should come and then we will take care of him. Just tell us what to do. Like he had some sensory issues. Everybody, they made sure not to shout, not to speak loudly. Whenever I needed to travel for any conference, my sister-in-law and my sisters also takes care of him while I was away. And later on, I've started spreading everything related to autism, spreading education and, you know, for the family. And this is what I have to do because of Faris. Yeah.
Well, that's really great information you're sharing with us, and you're helping a lot of our viewers watching us tonight about this condition. But how about the people? Like, it can be, it can happen to any family, any mother, any parent. So what kind of advice you would like to give with parents with newly diagnosed children, how to deal with the situation based on your experience?
Maybe you know that I have a very active social media. I'm like considered as an influencer. I posted all my stories while raising Faris as an autistic. The first thing I advise the parents is mainly for the caregiver, wherever it's a parent, it's a mother, it's a father, it's a sister, you have to take care of yourselves first, because you cannot help a child with a developmental delay if you're anxious, if you're depressed, if you don't even can deal with yourself, if you're unhealthy. So first of all, deal with your emotions. You need to deal with your health. You need to be as strong as possible to be able to face this dilemma and to act towards it. So for parents, for caregivers, to take care of themselves first.
Well, that's really great information from your behalf, Dr. Huda, and we still have a lot of questions to ask you. But the viewers, let's take this report to share with you, and it's also a break from our interview with Dr. Huda, such a great interview, and we'll be back with Dr. Huda Almahdi. Stay tuned. We're back, our viewers, with Dr. Huda Almahdi, a consultant physician and a mother of an autistic child and influencer regarding autism in social media. Welcome back, Dr. Huda, and such valuable information you're sharing with us tonight.
Thank you.
We're also wondering about you encouraging mothers and parents and people with this, having this condition for when it comes to their child, or it can happen to any family member. It can be a brother, it can be any siblings, any relatives. So how do you encourage independence while still offering support?
Well, because autism, the problem is with autism is they have issues with the society. They can't adjust to the society because It's a neurodevelopmental disorder that renders the child from dealing with others in communication. So the problem is communication. And when we talk about communication, we mean language, we mean eye contact, we mean understanding abstract moves and what is said by others. So what we do is that, first of all, we have to identify the level of autism in every child, because as you know, maybe it's a spectrum. So it might start with mild to severe. Like, I'm very lucky that my son is high functioning. It means that academically he's fine, he can learn. Also, he learned how to talk, so he had this, as we say, the language, and he can communicate. But what about other children who have problems with communication? So we have to encourage independence. It means, when we say being independent, means that he can eat by himself, he can ask for what he wants by himself, he can go to the toilet by himself. This is what he has to do by himself. And then when dealing with the environment around him, he has to know how to protect himself. As for high-functioning autistics, like my son, the technology really helped me making him independent, like having a mobile phone. I have a GPS. I have, like when he deals with money, he has the card. I'm really blessed that he has a language. He can talk, he can express his feelings. Such things are really important. But at the same time, I cannot tell you that he is 100% independent. So many times he still have his sensory issues. He still have some communication issues that he cannot understand what other people say. So I have to be there, or me or his father and his siblings needs to be there all the time. For other autistics with severe autism, they need a caregiver to be like shadowing them all the time, especially those who are nonverbal or those who can't even still handle themselves when it comes to hygiene and stuff. So that is the main issue.
Okay. When it comes commonly about autism and people awareness about autism and the different kinds of autism,
yeah.
Do you believe like people around us need more awareness about autism, or they still misunderstand the most about autism?
If I want to compare my situation 28 years ago, where this is Faris's age, we have came along of information, and the social media really helped a lot of parents to get resources on how to handle their children. Moreover, now there are lots of institutions that are really working hard and doing the research on how to prevent autism, because there's still, it's unknown, the reasons are unknown, but what the factors are contributing in having an autistic child. And also other institutions are really working on finding ways to, for the autistic to be able to communicate with others, so will be able to live in his community and society. That's what it is.
That's great. So speaking about the society, since you mentioned the community society, it can be also the workplace, schools. It's all social interactions between children or between students or employees, and our brave warriors of autism and the brave heroes of autism, they get interacted sometimes in workplace and also at school. So what kind of support do you wish it existed in schools and workplaces, or you want it to exist in workplaces at school also?
First of all, understanding what autism is. But I will have to tell you again, autistics can't learn or live in a normal, I would say, normal environment. Like, a lot of parents are insisting that children to be integrated are enrolled in normal schools. For me, it needs a lot of efforts. Why? Because for example, like, I will tell you my son as an example. He was in a normal school, in a mainstream school, and sometimes he stays in a normal class. He had the sensory issues that he can't tolerate the children's noises, because children usually, they shout, they scream, they talk in a loud noise. He couldn't handle that. So this is by himself like torture. And like, my aim is for the autistic to learn. they have problems learning from other normal children. So I will have to prepare the environment for them. So I think it's inappropriate to stay in a mainstream school unless this school is prepared for an autistic child. I mean, for the child, a normal child, to learn, he has to have his behavior controlled. He has to sit on a chair, he has to focus, to have eye contact with the teacher, and he has to focus. Autistics lack this kind of conditions. So I don't think enrolling them in mainstream schools is a good idea, but enrolling them in institutions run by people who knows what to do, and they are specialized in special needs and in autism in specific, I would really think and encourage this to do.
I really believe that you are really proud of Faris, and Faris is really proud of you. So it leads us to ask you, Dr. Huda, about what exactly, and it's one of the most frequently asked questions to you, I believe, from people or parents with dealing with the same condition or same case, or people also, they are curious to know your great successful story. So what helped you or what helped your son become more independent and confident?
It's early intervention. At the beginning, he had no language, he wouldn't sit still, he had, and I thought he was mentally retarded, to be frank. But when I first started to get to do my research and find some resources, and this is the first book I ordered online, it was Dealing with Children with Autism. It was like a cookbook. Anything I read, I would implement on him.
Great description.
Yeah, it was exactly like that. Later on, I knew that every autistic is special in his own way, but they share the same symptoms sometimes that you will need to deal with. So I, first of all, early intervention really worked with him, and then after that, when I really worked on his behavior and his communication, he started to become better, and he started to learn more and more.
That's really great. We are really thankful to you, Dr. Huda, for sharing this valuable information and great and successful story you shared with us regarding Faris. He's a hero with autism, and he's battling this autism, and we are all proud of him, and all the heroes same as his case. But before we end this inspiring and amazing interview, we would like, please, from your behalf, to share with us a message for the parents who feel really overwhelmed.
First of all, do not hesitate to ask for help. Once you notice that your child is speech delayed or he has some weird behavior, especially for mothers who had previously are mothers, like have older children, there are some specialized doctors for like developmental disorders. They can detect that. And even if your child turns to be normal, you should do whatever you have to do just to check that he's normal or having any issues. And God forbid, if the issue really he turned to be an autistic, then you will have to work on yourself, speed the process of accepting the child, and try to help him soon. And early intervention is the best way to treat autistics.
Thank you again, Dr. Huda, for being this evening with us on Hala Kuwait, and we really salute and cherish your noble quest to spread awareness about autism, and also taking care of the hero, Faris, your son. And we wish you the best of luck with your future endeavors.
And thank you for your nice words. Thank you for having me.
Thank you. It's always a pleasure. The viewers, we just had with us Dr. Huda Almahdi, a consultant physician and a mother of an autistic child and influencer regarding autism in social media. Let's go now and share with you our third report of the evening. Then we'll be right back. Stay tuned.